This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, do bulging discs really matter on an MRI? If you like this video, we put out new content weekly, so please like and subscribe. So do they matter? Answer is it depends. So the older you get, the more stuff you find on an MRI of someone's back. So they did a study where they took people with no back pain, and they found the older they got, especially when they got into their 70s and 80s, their MRIs would look terrible. There was discs, there's arthritis, and these people had no back pain. So there's a whole lot of people walking around who don't have back pain, who will have all sorts of bulging discs or everything like that. All right, so that's the baseline level for a lot of people, is to have some level of bulging disc that exists in their back. So you may have back pain and you may have gotten an MRI and it may show some bulging discs. So when are they really bad? So if you have a disc that bulges so far out that it touches the nerve and you have pain in your back that goes all the way down your leg, that is when the bulging disc matters, because it's pushing on the nerve. And you can get the same thing in your neck, and actually in the neck it'll be pushing on a nerve and causing pain going down your arm. Then if it's really bad, it can also be pushing in the center of your spine and causing all sorts of other issues, and that's called myelopathy, and it's a pretty bad thing. In the lower back, you can get a similar sort of thing if there's a huge bulging disc and it's really pushing on the nerves bad. It's called cauda equina, basically where you lose bowel and bladder and you have saddle anesthesia, so you lose sensation inside of your thighs, and that's an emergency. But again, those are not the norm. They do happen, but if you get an MRI and there's just a bunch of discs, a little arthritis there, I wouldn't go after it. I mean, because you could have surgery and get that disc taken out and those segments fused, and you might still have back pain. That's why lumbar spine surgery for back pain has like a 50% success rate. If you do it for radicular symptoms, meaning the nerves are being pressed on for leg pain, then it has a very high rate of success. So anyways, a doc may have told you had a bunch of bulging discs. If you don't have any pain, when I treat patients, if they don't have any pain in their back that goes down their legs, and there's no sign of nerve impingement, I usually just ignore it. 90% of the time, a disc that's popped out will get sucked in to some extent. I usually don't worry about it, and I focus more on improving their biomechanics and treating their muscular pain, which is usually what it is. So again, to sum it up, if you have a bulging disc that's so big in your neck that it causes you to walk funny, or you have problems with handwriting, or a disc that's so big in your neck that it causes pain going down to your fingertips or pain going down to your legs, or you start losing feeling on the inside of your thighs, then the bulging disc matters and needs to be taken care of. If you don't have any of those things, then it very well may be an incidental finding, and the source of your back pain may not be coming from that one disc. So I hope I was able to answer your questions about, do bulging discs really matter on an MRI? If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. And again, if you like this video, please like and subscribe, and thanks for watching.